it's Dr. Wright. I'm just going to wait a minute or so, a few seconds, until people can log on. And so thank you for tuning in. And we'll officially start in a few minutes, or in less than a minute, I should say. Okay, I see some people joining in. I see lots of waves out there. And so I'm going to get started. Again, my name is Dr. Lakia Wright. I am a board certified allergist and immunologist. I'm also medical director of U.S. Clinical Affairs at Thermo Fisher Scientific in the Immunodiagnostics Division. So I know that is quite a long title. And welcome to Right Now Allergy Updates with Dr. Wright. And so today we'll be talking about food allergies part 2, early food introduction and testing. So basically what I wanted to do today was to just go over some of the things that, we went over last time, do a little recap, and then add on to dive a little bit deeper into those signs and symptoms that may suggest that your baby or infant is having, or even your toddler is having an allergic reaction. And then talk about, testing. When is testing appropriate? So let's talk through the recap from last week. So early food introduction, it can be a very scary prospect, but it is necessary. And we know that with early introduction, you can try to prevent the development of food allergies. And so the first thing is the baby needs to be ready to have the food introduced, being able to hold up the baby's head and then be able to thrust the tongue. We discussed all those things. And then you don't want to just start with those common food allergens. You want them to, eat other foods first. Typically, there would be some sort of cereal, grains, maybe perhaps introduced first, and then maybe some fruits and vegetables. And then you go in for those, common food allergens, but in an age appropriate way. And so when I talk about the common food allergens, again, we're talking about the milk, the egg, peanut, tree nuts, wheat, soy, fish, shellfish, and then, the 9th common allergen out there is sesame as well. And so, we talked about early introduction, and typically before the age of 1, we do have the most information for a peanut, and especially in infants that are high risk. And high risk is really defined by infants who have eczema. We know that is a risk factor for food allergy development. And when they have eczema, we're really talking about that moderate to severe eczema. Do they require medications? And in those individuals, we have the learning early about peanuts study, and that study suggested that 4 to 6 months would be the right time to introduce. And we're gathering more and more data, and we know that per the American Academy of Pediatrics guidelines, you want to try to get those foods in before the age of 1. And so that's really a recap, from last time. And then I wanted to, specifically talk about, well, what about, what are the common food allergens in babies? And the most common are the milk and egg. But the thing about milk and egg is that, children, and the majority of children, will outgrow those allergies. And that's in contrast to peanut and tree nut, because then those children are sort of less likely to outgrow those allergies. But again, there are, research is evolving, and then there are more treatment options coming to the market and already on the market in the case of peanut allergy treatment. And so, we want to move on to the next question of how can I tell if my baby is having a reaction? And we're focusing on the infants because, they're not going to tell you that, I'm itchy or I can't breathe or anything like that. So you have to look for those signs of what can be an allergic reaction. So we're talking about hives, and hives are not just redness in the skin. It's really that it's red and sort of rays coming off the skin. So if you feel it, you can feel that it's sort of elevated. And sometimes it can have some blanching, meaning it's red, but then when you press down on it, it turns like a paler color. And so hives is one. Any lip or tongue swelling, that would be another one to look out for. Vomiting, diarrhea. If the baby is very lethargic, just not really, arousable, coughing, wheezing, fussiness and irritable, being really irritable can also be a sign. And I mentioned the vomiting and diarrhea. And sometimes when you're doing when you're monitoring for those signs, you really need to remove the baby's clothing to really do a full skin exam and do an assessment. And typically with food allergy, because I get this question all the time, is the timing. When do reactions occur? Some people describe it as early as like seconds, or minutes. And then it can happen up to 3 to 4 hours, because sometimes the food needs to be digested, and then the allergy cells are activated. So that leads us to our next part of, when is testing appropriate? Because that is a question that I commonly get. And so allergy testing is really for those who have signs and symptoms of an IgE mediated allergic reaction. And what do I mean when I say IgE mediated? So IgE is an antibody that your body produces, your immune system produces. So you can take in like a food, and if your body perceives it as an allergen, it should perceive it as something that's harmless, but if it's perceiving it as a threat, as an allergen, it starts to produce IgE antibodies, and it sends off these sort of alarm signals that are saying, alert, and so those IgE antibodies are testing for the presence of them in the setting of a patient having symptoms. That really helps to make the diagnosis of allergy. So it's really twofold here. So you have the symptoms on one hand, and then you have the testing on the other hand, and then you marry the two together to make that official diagnosis, to try to pinpoint, exactly, you're trying to pinpoint as a clinician exactly what's going on. And you really want to lead with the patient's history, and then order the appropriate testing when they're having the IgE mediated, symptoms, those antibodies that are telling, the body is producing to say, this is an allergen, this is a perceived threat. And so now that you know the background about, the mechanism of action and what antibodies are involved, then we can move on to talk about, what sort of allergy testing is out there. So there's skin prick testing, and that's where they take like the drops of allergen, put it on the baby's skin, or it could be even adult. This is the same sort of testing modality. And then the allergens on the skin, you wait 15 minutes after pricking the skin to see if there's a reaction. And a reaction is like a red, bumpy sort of response. That would be a positive. Your body is reacting to that allergen. And sometimes it can look like a hive or a mosquito bite. And those results can come in about 15 to 20 minutes. But then there's also allergy blood testing, and that's when you get a blood draw, and it's looking for those circulating IgE antibodies, and then taking the measurement, so it makes it quantitative, measuring those IgE antibody levels, and that takes a couple of days or a few days, depending on the lab, when the lab can get it back to you, but typically a couple of days to a few days. And that result is quantitative. So skin testing is semi-quantitative because you can measure the reaction on the skin, and then the blood testing is quantitative. And then when it comes to food allergies, many may use a combination of these testing to try to, figure out what's going on, and perhaps even monitor it over time. And so those are the two types of testing. And again, I want to emphasize it's really about those symptoms, the common symptoms of an allergic reaction within minutes to hours. That's when you want to do the testing to try to pinpoint, what is the culprit food here, and you want to, because the testing helps to aid in the diagnosis, but not make the diagnosis. So it's so important to talk to your doctor about, what symptoms did your baby have, and then what sort of testing would be appropriate as a result, because it's really based on those symptoms. So I'm gonna move on into my myth busting section. I always have a hard time saying that, myth busting section. And so the statement is, true or false? Is this a myth? Is it fact or fiction? And so babies can't outgrow allergies. And so that would be false. You heard me say that with milk and egg, the majority of children will outgrow it, typically by the age of 4. And then with peanut and tree nuts, those are less likely to be outgrown, but that doesn't mean that they're never outgrown. So it can, be outgrown. So that's something that you have to talk with your doctor about, and then they can tell you, where is your child in this trajectory? Are they moving towards outgrowing it? That takes, doctor visits, clinical history, and testing to help aid in that diagnosis and figure that part out. And so I'll turn now to audience questions. If there are any questions out there, I'll go over a couple of questions that I commonly get asked just to get us started. And so, should my child be tested before I introduce the foods? So generally no, because again, there's a difference here between IgE sensitization, which means that the antibodies are circulating in your blood. And those who have a lot of allergies, who are atopic, for example, if they have eczema, things like that, they may have these circulating antibodies. But then there's a difference between the sensitization and the allergy, and that's where the clinical history comes into play. Because for those who have symptoms, and then you do the testing to see if those antibodies are there, that helps aid in the diagnosis. That helps you pinpoint the, in this case, we're talking about food allergies. Now, there is one exception with testing beforehand that you can give consideration to. You can talk to your clinician about it, is with the peanuts. So remember I told you about the Learning Early About Peanuts study that looked at high risk individuals, those with eczema and egg allergy, eczema that was bad, or poorly controlled, moderate to severe, and that really required medications. And so in that group, you can consider based on that data, and then now with these, because that was 2015. So now with the newer guidelines for 2021, you can consider the testing of those, high risk individuals prior to the introduction of peanut. So we're specifically talking about peanut here. It's really a conversation to have with your doctor, because your doctor can consider testing beforehand, but it doesn't mean that they absolutely have to do it. It's a conversation that has risk and benefits. So that's a conversation that you would have with your doctor. But I want you to know that is one exception that you should have that conversation with your doctor about. And so let's see here. I'm going to go to a question here. Is there anything parents can do to be prepared for an allergic reaction, like have Benadryl on hand or another antihistamine? Yes, that's a great question. So I think it's good to have, dihydrophenamine. That's the generic name for Benadryl. I think it's good to have some of that on hand. I think that what's also good is that you keep the medications, the Benadryl, and make sure you have that on hand. And then also making sure that if you're concerned about anything, also taking a picture of it. Of course, after you tend to the baby, taking a picture of it to make sure that you have it as a reference point for your doctor. Now, of course, if there's any severe symptoms, you think that your baby's having problems breathing, then you call 911. But, if you're thinking, well, I'm not sure if this is a hive or not a hive, and, but the baby has no other symptoms, then you can, call your doctor and talk to your doctor about, well, can I give the baby some Benadryl? Because the thing is, with this dihydrophenamine, you want to make sure you're giving the right dose, and that's something that your doctor, you would have to talk to your doctor about. But I think that it's completely fine to have it, just in case, and then you talking to your doctor. But in a case of emergency, the baby's lethargic, or you think that the baby is unconscious, or you think that the baby's wheezing, can't breathe, that warrants calling 911. Because if a child, or anyone for that matter, is having a severe allergic reaction, anaphylaxis, the primary treatment of that would be epinephrine. So we have the same epi first, epi fast. So you would need to call 911 if there's any sort of emergency going on. But I do appreciate the question, because you do want to be prepared. And then that brings me to my tips. And so, I reviewed some of these tips last week, and because you really want to, it really, that question goes well with, being prepared. So let's review from last week those tips about early food introduction, signs and symptoms of an allergic reaction. So first, you want to talk to your pediatrician to help assess, is your child even ready for foods to be introduced. And there are other considerations like, breastfeeding and things like that, when to wean the child from breastfeeding into the solid foods, but they have to be ready first. So that's a conversation to have with your doctor. And typically you're deciding that in 4 to 6 month range. But again, in other children, it may go on longer, because they may not be ready to have the food. So that's why it's so important to talk to your doctor. So number one is talking to your pediatrician. And I will say another tip that I have is, how you go to the pediatrician, and there are so many developmental milestones that you have to go over with the pediatrician. They have to look at the weight, how the baby's growing, the length, and things like that, sleep. And so it's really important that you talk to your doctor to say, do we have time to talk about early food introduction now, or should I, set up a separate appointment just to address this issue? And many practices are still doing telehealth, so it can be a consideration for you to do that as a separate visit, as a separate telehealth visit, if you feel like you really want to dedicate the time, that you'll need more designated time to address this issue, because it can be pretty packed. And so once you talk to your doctor, you get the go ahead that the baby is ready from the doctor. Then you want to do the meal planning. So that's really tip number one. Number two is, once you introduce the foods, you really want to keep that food allergy, food diary, because you want to monitor for any signs or symptoms of an allergy, and you want to have that documented. And then you can introduce foods about every 2 or 3 days, new foods. You don't take out the old foods that you've already introduced. You just keep adding on in an age-appropriate way, and walking through what that looks like with your pediatrician, as I mentioned in tip 1. So now tip 3, if you're concerned about any symptoms, of course, which we mentioned before, you have to call your doctor. If it's an emergency, of course, you call, 911. And so that's why we went over the signs and symptoms, so that you can be well informed about what a potential reaction can look like, and then when it would be appropriate to call your doctor. And then when, you're really in an emergency situation, you really have to call 911. And remember, for the testing really depends on the clinical history. And then you can talk about that one exception with, peanut with your doctor if you have a high risk baby, meaning a baby that has eczema or an existing egg allergy. But it looks like with the new literature, it's more about the eczema. That's a more of a leading indicator that an infant is high risk. So I'm going to, those were all the questions. I am going to close it out now. I'm so happy that I had the chance to talk to you guys about this important topic. Next week, I'll be coming back with another topic. But until then, if you like the video, please, give it a thumbs up, and then also please share it. And for additional educational resources, click the link in the video description, which will bring you to Allergy Insider. Until next week, see you then. Bye-bye. Take care.